We are a week away from the end of Governor Ducey's stay-at-home order, and 12 News is getting more information about some models the state is considering for reopening Arizona. Team 12's Josh Sanders spoke with the author of an ASU study on projections and models for the virus prepared for the Department of Health Services, which offers several scenarios for reopening and what the state may be considering.
The report provides the state with 5 scenarios and a range of projections, from the number of people that will be infected by the virus to the number of people that will need ventilators. But this is the most sobering takeaway: the potential for thousands to die by the end of July if social distancing ends too soon.
I want to get back to where we were as much as anybody in the state, but I want to do it in a safe and healthy way.
Those words from Governor Doug Ducey at Wednesday's COVID-19 press conference. Ducey announcing he's lifting a ban on elective surgeries beginning May 1st. 12 News getting more insight on the models the state is considering to reopen Arizona.
But as we go through the model, we are very focused on issues with Arizona, and our model is increasingly going to be able to inform decisions about whether or not we're meeting the criteria to open up America again.
Dr. Timothy Lant leads a team at Arizona State University tasked by the state to track the disease.
There's still some scientific uncertainty around testing of cases and around decreasing effects over time due to climate. So we have scenarios that outline which one of those we think are potential, and as we start to get closer to some of the scenarios that we have, we'll understand why we're doing that.
At this time, the state is prioritizing Arizona's healthcare system and is reviewing models related to anticipated hospital bed and ventilator projections. The ASU report takes those factors into account, but also looks at the projected COVID-19 deaths. Focus on these 2 middle lines. They show the difference in possible deaths if the state reopens instead of keeping us home.
So reopening too soon would mean allowing people to go back to a situation where they're in contact with each other and the disease starts to spread significantly enough that it starts to put additional strains on the healthcare system and hospital resources.
This is just one model the state is considering. ADHS is also looking at projections from the University of Washington and a national model from the Center for Disease Control. This is something we'll continue to follow as information changes daily. For more on this story, check out our 12 News app. For now, in downtown Phoenix, Josh Sanders, 12 News.
Josh, thanks.